In this episode, we're talking about pregnancy. In the last episode, we talked about conception and the developmental stages in the embryo. Now we'll be talking about pregnancy, signs and symptoms of pregnancy, presumptive signs, probable signs, then positive signs. Yes, there are positive signs of pregnancy. You can presume you're pregnant. Sorry. You might see signs that you consider, yes, I'm pregnant. That is pseudo pregnancy. But there are positive signs that confirm this pregnancy. And there are minor disorders of pregnancy, and there are ways to manage it. Understand? There are ways to manage it. So we'll talk about the management. We'll talk about lying position. Yes, pregnancy means you need to be careful of the way you lie and feeling about sex. So, and if sex is advisable during pregnancy, and many people ask questions. Is it good to have sex during the first 3 months or during when you're approaching your due date? What position to take? What is the position that is uh, conducive for the baby and the woman? So, and we are told that pregnancy is a time used to describe the period in which the fetus develops inside the woman's body or uterus. And pregnancy lasts for 37 to 40 weeks. And that 40 weeks is usually the 9 months. Signs and symptoms of pregnancy. Usually for most women, pregnancy is a thing of joy, yes. For married women, actually. And there are signs, the presumptive signs that can make you think, yes, that you're pregnant. We have nausea. That is the feeling of nausea. You want to vomit. You have your breast enlargement. A missed period. Amenorrhea. You've missed your period. Fatigue. You're tired. Poor sleep. Back pain. Constipation. Food cravings and aversions. Mood swings. Heartburn. Nasal congestion. Shortness of breath. Lightheadedness. Elevated basal body temperature. Reddening of the palms and spider rings. We have the probable signs. These include increased frequency of urination, soft cervix, abdominal bloating / enlargement, mild urine discomfort, increased skin pigmentation in the face. That is, stop having pimples. But the positive signs include faster heartbeat, visualization of the your fetus. That is, you've gone for your ultrasound. You are sure that you're pregnant. Positive human chorion gonadotropin. That is the HCG in urine or blood. Then we talk about the minor disorders of pregnancy and management. During pregnancy, one's body changes in many ways. This can sometimes not be you will not be comfortable with your body. And this includes nausea, that is vomiting. We have pica, that is craving for food that may not be nutritious. We have heartburn. We have constipation, hemorrhoids, that is piles, owing to the relaxation of anal veins and as a result of pressure by the gravid uterus on the anal veins. And to avoid this, you have to take water, eat plenty of fruits and vegetables. You have varicose veins. That is when you have swollen veins may appear during your pregnancy. Most women are advised to lie and use something soft to raise their legs while sleeping. And women who have these varicose veins are advised. They are usually advised to deliver in the hospital because the pressure by the gravity uterus on the veins that return blood to the heart from the legs is a major causative factor for this varicosity of the legs. They have the back pain. Yes, it's natural that many pregnant women experience back pain due to the weight of the baby and the amniotic fluids. Headaches and migraines, they are usually uncommon during pregnancy, and it is severe around the second and third trimesters. Odema, swelling of the ankle and feet are common during pregnancy. Yes, women experience this. And if the swelling is seen always on her body, that is the face, the legs, arms, and hands, it is advisable you go to the hospital. Avoid salty food and drink water and natural juice. If your pregnancy makes you to urinate so much, you have to be careful, maintain a good hygiene so that you avoid infection. Because infection with pregnancy, very, very bad. Then vaginal discharge. This is normal. Discharge is the wetness you experience during pregnancy. There is a lot of discharge because of the progesterone hormone. Discharge should be clear and colorless without any odor. If the discharge is offensive, white, gray, brownish, or lumpy, it may be a sign of infection, and you're advised to go to the hospital. And you, as a pregnant woman, it is advisable you wear cotton pants, maintain good hygiene, wash your undies regularly, and take your bath at least twice a day. Then shortness of breath. Most women don't breathe very well during pregnancy, and yes, just choose a comfortable position to lie down. More pillows may be used. Everything will be normalized after pregnancy. That is it. Yes, and the most important thing to talk about pregnancy is the lying position. A pregnant woman should not lie flat on her back to avoid posture hypertension. It is very bad for a pregnant woman to lie on her weight on her back. Very, very bad. A woman should lie by her side, the left side and the right side, and the left side is mostly advisable. Worry and fear. It is normal for a married woman who is bringing forth a newborn to be afraid, to be worried. I don't know the outcome of this pregnancy. Will my baby be normal? Will it be healthy? You know, all these things. And pregnant women, they tend to have sleep problems during the first trimester of the pregnancy. But as time goes by, it reduces. Women also have strange dreams and nightmares during pregnancy. They can be frightening, they can be vivid, but the subconscious mind is what causes this. And we are told that if you're pregnant and you're having all these dreams, you should calm down and remove the fear of the unknown. And as we are all believers of the faith, you should put your trust in God. Feeling about sex, having sex during pregnancy is not bad. It does not cause any abnormality to your faith, to your baby. Just choose a comfortable position, either sitting or the woman on top of the man. It depends on your choice. But sex during the first trimester is not advisable, and 6 weeks to the time of the delivery to avoid infection.